Molweni, Sanbonani, welkom aan van de middagse geleentheid. Welcome to this third annual Bongani Mayosi lecture, memorial lecture, the second as an eponymous UCT lecture. Welcome especially to Professor Nonhlanhla Khumalo and the extended Mayosi and Khumalo families, to all of our friends and colleagues who have joined this evening. Thank you especially to the team of people who have helped create this evening. To the participants tonight, Professor Pakeng, the Vice Chancellor, Mr. Sizwe Nxasana, Chair of the Bongani Mayosi Foundation, Professor Mashiko Sechedi, St. Anne's Chair and Head of Gastroenterology, Dr. Matsiliso Moeti, a especially warm welcome to you, the World Health Organization Regional Director for Africa, to Ms. Linda Roda and your technical team, Enkosi kakhulu, Kaisikai Gangans. Tonight is a celebration of stories. The stories of our ancestors in whose footsteps we tread. The stories of those who walk alongside us looking for someone to lean on, and those who offer a shoulder of support. The stories that we are still to create, and those we will share with those who follow us. In the spirit of our multiple and complex stories, our faculty has opened a heritage garden to honor those whose sacred human remains have been in our laboratories, sometimes unethically, under study for the last century. The Heritage Garden honors their story and its intersection with ours, as a faculty, as a university, and as a nation striving to make an impact in our world. The Heritage Garden also offers a reflective space in which staff and students may also reflect on their own journeys and their possible and multiple destinations. On occasion, the Heritage Garden may become a spot to reflect on the stories which our ancestors have written for each of us in the stars. This place is, after all, called Observatory, a place where people may see the stars. This place is called, after all, Kamirodi Khais. In the language of the original people of this region, the Khoisan, Kamirodi Khais means place of the stars. But tonight, friends, is an evening of reflection on the people whose stars often become our lodestar, guiding us to greater achievement. Bongani Mawetu Mayosi is one such star. Tonight, we remember his journey from a rural background and a family of learning into an icon of national and global impact. Tonight, we will remember his ability to take on those people who would peddle falsehood, often because of their privilege and status. In reflecting on his story before tonight, you too may have heard his voice refuting those who would challenge the validity of areas of science such as vaccinology. In this time, in fact, I can imagine that he would have been an advocate for greater vaccination, for greater justice and more equitable distribution of vaccines. But our remembering tonight must really be about looking forward, so that it helps us imagine a future that is inclusive and progressive. I want to use the voices of a couple of African scholars to amplify some of the areas of Mayosi's life, the areas of mentorship, interconnection, as well as complexity and relationship. A group of African scholars contributed to a 2019 paper on mentorship about competencies for low and middle income countries. Amongst these are two South African women, Nonhlanhla Khumalo and Letitia Rispel. They say in that article, effective mentorship helps mentees to reach their full potential, to create and disseminate new knowledge, to invoke positive institutional change and build local capacity. The benefits of effective mentorship extend into the health system and can lead to improved quality of clinical care in resource-limited environments. Ambrose Wonkum, an African export to the United States, reflects on interconnectedness when speaking about the African Genome Project in 2020. He spoke about the power of the confluences of collaboration, workforce development, and governance in ensuring that the African agenda is foregrounded and advanced. The notion of complexity and relationships comes through in this comment by John Nkengasong of the African CDC, writing in the journal Cell in 2020. He says, the COVID-19 pandemic has clearly demonstrated how interrelated disease threats are with economies. Close collaborations with institutions like the African CDC and others is essential to ensure that the public health and disease threats are controlled. So much of Professor Mayosi's story is characterized by his inimitable capacity to mentor, as well as his deep understanding of complexity, reflected in the multiple relationships across sectors and across the system. Welcome to this evening's lecture. Tonight is a celebration, a moment to celebrate a legacy of African scholarship in the company of an African scholar who helps us build on our promises. This evening's structure is that you will watch a video that has been prepared from the Bongani Mayosi Foundation, a praise song, and comments on his life. After this, Professor Sachedi will introduce the guest speaker. Dr. Moeti will then address us. The VC, Professor Pakeng, will make concluding remarks, and that will be the end of the evening. But let's join the celebratory moment of how our legacy meets our promise with these celebratory videos.
Good day. My name is Sizwe Asana. I'm the chairman of the Bongani Mayosi Foundation. It is again a pleasure to partner with UCT as we celebrate the second 2022 UCT Bongani Mayosi Memorial Lecture. It's become a very important event on our calendar, especially because we invite a number of eminent speakers to talk about things that are topical, especially that affect the health of our communities. Last year, we announced that we had embarked on a process of selecting those people that participated particularly well at medical schools in not only academic excellence, but also showing public service. This year, based on the nomination process that happened in 2021, towards the end of the year, we're very pleased. All the 9 medical schools of young people who've now qualified as doctors, who have demonstrated academic excellence as well as public service. All 9 medical schools, including UCT, Stellenbosch, Walter Sisulu, Free State University, Wits, UP, SMU, Limpopo University, and UKZN, participated in this process of selection. The Bongani Mayosi Foundation continues to focus on some of the programs that are really important and are in line with those things that Bongani Mayosi was passionate about. Those include addressing the issue of mathematics in schools, as well as the intercalated program which is currently run at UCT. Of course, there are a number of initiatives, particularly at UCT, and we are very honored and thankful for the partnership that we have with UCT, as well as with all the other funders and donors that have supported the initiatives of the Bongani Mayosi Foundation. I thank you.
sakuqubana inhliziyo, kuthoni na sakuqubana imvakalelo zenhliziyo. Hayi sisixaka ngqondo nophefumlo. Rhatebe, mashobathe wena washobathela inkomo neempondo. Mafuza fulele, wena ufulela izulu ngezembe. Njengoba abanye abantu befulela ngengqanje, wena ufulela ngezembe ngoburharha bakho. Ayabonga, ayabulela mawethu ngomsebenzi ongako owenzileyo. Ayabonga, ayabulela mawethu ngobuchwepheshe nobugorha bakho nezenzululwazi kwezempilo. Jonke ilizwe ulijongile ngokwenene, awukhange woyike ngokoyikiswa. Lifule mvula, hlube lihle, sawuzawubhucwa mnyama nozipho ngokuqhwayana. Nanku umsebenzi wezandla zakho Rhatebe. Nasi indwalutho ziqeqeshwa, zihlohlwa, zihlolwa. Ukwenza kwakho mthimkhulu, nokuba sisivile isithonga sokuwa kwakho. Bongani, ndlebe entle zombini, imisebenzi yakho isabonakala. Ezo ndlebe ziseva nangoku zombini, izinqi zakho zisavakala. Izizwe zonke zisondelelene, zihlanganiswe nguwe Bongani. Omncinci nomdala uyaxhamla, uyanyukela kumfundo ephakamileyo. Dlezane nombelo omde, dlikihla bemhlasela. Uyokuhlala uwongwa kwele mimoya, uyokuhlala uwongwa nakwele nyama. Nqwanqwada nakulo msitho Rhatebe. Ngena ubukele ucebise kunye nookhokho bethu kwele mimoya. Nokuba ngathi awukho kodwa usekhona, nokuba ilizwi lakho ngathi livakali kodwa liyavakala. Ngena uphume uhlale ngoxolo ungenakhala kulo msitho. Mfoka Mayosi, ndesithe.
Professor Bongani Mayosi, insightful researcher, clinician, leader, friend, and devoted family man, was born in Mthatha in the Eastern Cape on the 28th of January 1967 and died in Cape Town on the 27th of July 2018. He had the capacity to create the vision of a world of justice and equity far beyond our limited imagination. His immeasurable legacy continues to inspire people throughout the University of Cape Town and across the globe. Professor Mayosi made immense contributions. He transformed the Department of Medicine at UCT to become the largest and leading medicine department on the African continent. He also made it more inclusive, inspiring many young trainees, especially black students, to become academics. He trained several cardiologists and other specialists emerged from his department. As a researcher, Professor Mayosi was a global leader in his field and a doyen of heart-muscle disease on the African continent. Professor Mayosi's discovery in 2017 of a new gene that causes sudden death in young people was considered one of the most important medical advances made by a South African scientific team since the first human heart transplant. He was passionate about building a better understanding of cardiovascular disorders of the poor. He deepened the understanding of heart failure and the associated heart disease and gave new prominence to the challenges posed by tuberculosis pericarditis, which is a TB of the outer membranes lining the heart. Following over a decade of research in rheumatic heart disease, Professor Mayosi was at the forefront of bringing global attention to a disease that affects mostly the poor, landing it on the agenda of African institutions, the World Health Organization, the World Heart Federation, and the United Nations. He published over 350 peer-reviewed articles and book chapters during his lifetime, and some have emerged posthumously. Many of his papers have been translated into policy and adopted by global organizations. He also made important contributions to the strengthening of health systems in South Africa and other African countries. A seminal work contributed to a greater understanding of the role of the clinician scientist and the importance of growing this cadre in South Africa. Professor Mayosi's impact on the institutions he led was far-reaching. He won numerous awards and accolades, including the National Order of Mapungubwe Silver in 2009 and an A rating by the National Research Foundation. He is widely remembered for the positive effect he had on people everywhere, encouraging self-belief in his colleagues and students, many of whom excel in their fields today. Professor Mayosi's colleagues say they'll carry his life lessons with them wherever they go. A favorite saying or Bonganiism that they speak of is "lift as you rise." This was his call for colleagues to help build capacity, mentor, and create opportunities for others as they grow and succeed in their fields and studies, thus promoting African excellence. He lived what he preached, and it is no surprise that Lift as You Rise is a theme underlining initiatives developed to honor and build on his legacy. Our partner host, the Bongani Mayosi Foundation, was established by his family to honor his legacy by fostering the academic, research, and training programs about which he was so passionate. To honor Professor Mayosi's legacy, the University of Cape Town dedicated physical spaces on its Faculty of Health Sciences campus in his memory. The library has been renamed the Bongani Mayosi Health Sciences Library. The passageway alongside the library and the link bridge with Grooteskier Hospital houses a celebratory exhibition of his work and the values that he epitomized and much-loved Bonganiisms or sayings. The university also established an annual UCT lecture in his name, an honor bestowed only on an individual of the highest standing, and so institutionalizing the legacy of Professor Mayosi. These UCT annual Bongani Mayosi Memorial Lectures are inspirational and serve as an annual gathering in celebration of African scholarship. They foreground African science and celebrate Africa's scientists and their excellence. They aim to showcase approaches to the needs of Africa that will inspire scholars to realize the dream of finding African responses and solutions to Africa's needs and the social determinants of health. The UCT annual Bongani Mayosi Memorial Lectures will be given by distinguished individuals from across the world, whose work embody the ideals that Professor Mayosi espoused and his unfailing commitment to equality, social justice, transformation, and excellence in the pursuit of knowledge.
Good evening, ladies and gentlemen. This evening, I'm proudly wearing my hat as one of Professor Mayosi's mentees, and I'm honored to have been tasked with introducing the guest speaker for tonight's lecture. Dr. Moeti needs no introduction. Notwithstanding, I wish to highlight why we, as the organizing committee, are delighted that she accepted our request to deliver this prestigious lecture. Dr. Matshidiso Moeti has had a long and distinguished career in public health and is currently serving her second term as the WHO Regional Director for Africa, having broken new ground as the first woman to ever hold this position. Her public health roots stem from her childhood, though ironically, she was, as a teenager, the last thing she wanted was to be a doctor, because both of her parents were doctors, and she wanted to be different. Ultimately, she did choose medicine, qualifying at the Royal Free Hospital School of Medicine. For someone who states that she rather stumbled into public health by default, her career as a doyenne in public health leadership is remarkable. Her introduction to public health was when she managed patients in a TB ward in Botswana and discovered firsthand about the critical role of preventative interventions in managing disease. Dr. Moeti is lauded for her work on curbing the HIV/AIDS epidemic in various positions, including as the head of the WHO Regional Office for Africa's HIV/AIDS program. This, she says, is her proudest achievement, where she played a key role in improving access to antiretroviral therapy for patients in Botswana, which at the time had the highest prevalence of HIV/AIDS. She also led the WHO's response to the Ebola outbreak in West Africa in 2015. The lessons learned from this experience, namely the importance of investing in public health systems that are responsive and resilient, political will, and international solidarity, no doubt informed her and her office's response to the COVID-19 pandemic. These efforts earned her the largest number of nominations from 25 different countries across Africa, received by the Ellen Johnson Sirleaf Presidential Center for Women and Development during their campaign called Spotlight the COVID-19 Heroine, reflecting the profound impact Dr. Moeti has had on the continent as a whole in her current role. She's an advocate for universal healthcare and an unapologetic feminist, involved in programs such as Women in Global Health Group and Women Lift Health, which mobilize women in leadership, create networks for them, as well as empowering them to apply for roles that reflect their capacity. In summary, therefore, Dr. Moeti embodies many of the values that Professor Mayosi subscribed to. And so to my mind, there is no one currently who is better suited to deliver the second annual Professor Bongani Mayosi Memorial Lecture on the occasion of what would have been his 55th birthday than Dr. Moeti. I speak for all of us when I say we look forward to what you have to say with great anticipation. Over to you.
Thank you. Thank you very much for that very kind introduction. The Vice Chancellor of the University of Cape Town, Professor Mamokgethi Phakeng, the Dean of the Faculty of Health Sciences, Professor Lionel Green-Thompson, Professor Mayosi's family, first Umama Nontle Mayosi and Professor Nonhlanhla Khumalo, members of the Bongani Mayosi Foundation, faculty, staff, fellows, students across UCT, ladies and gentlemen, and I know I'd like to say a special hello to a network of Botswana doctors who told me they would be going to join the lecture. Good afternoon, good morning, good evening, depending where in the world you are, and greetings from an icy Geneva where I'm attending the WHO Executive Board meeting. It is an absolute privilege, a huge pleasure to have been invited to deliver the second Bongani Mayosi Memorial Lecture, just a few months short of the 4th anniversary of the untimely and tragic death of this brilliant and compassionate son of Africa. I'd like to express my deepest appreciation to Professor Green-Thompson for this honor, which comes at a time when COVID-19 is inflicting deep wounds across the African continent, and when it has never been more important for our continent to take the reins of the health and well-being of her people. I also want to appreciate the Mayosi family and the foundation for all the work to reduce poverty, to promote and support healthcare for the poor, and to offer learning opportunities to our future doctors and scientists. I watched with great pleasure the video depicting the work that is being done. In the response to the COVID-19 pandemic over the past 2 years, our continent specifically and the world have been poorer without the commitment, the skills, and the razor-sharp insights of this outstanding clinician was Bongani. I'm sure there are many of us across Africa and further afield who found themselves pondering the question, what would Bongani do? I've often thought myself, what would Bongani advise? What I can say with certainty is that Professor Mayosi would be using his scientific intuition and insights, along with his position as a top cardiologist and one of the world's premier medical researchers, for the good of South Africa and the world at this difficult time. He'd also have been a powerful ally to the World Health Organization in Africa during the past tumultuous 2 years, as we fought for equitable access to COVID-19 vaccines and other critical tools and commodities. Prof. Mayosi had a very close relationship with WHO, bringing his expertise and wisdom to a broad range of committees and working groups. From 2012 until his passing, he was the revered chair of our African Advisory Committee on Health Research and Development. He helped to resuscitate and re-energize this committee, which under his leadership facilitated the development of a research strategy for WHO in the Africa region, as well as the means to measure the impact on strengthening of national health research systems. The COVID-19 pandemic has especially highlighted the critical importance of research for public health emergency and disaster preparedness and response, supported by appropriate funding. The last time Bongani visited our health office in Brazzaville was in 2017, when he chaired our 32nd committee meeting. Internationally acclaimed for his impact on medicine in Africa, as a researcher, an educator, and administrator, Professor Mayosi was equally renowned for his contributions to the personal and career growth and development of others. His work ethic was legendary, as was his kindness and generosity. His enduring legacy is of research excellence and academic development, along with, of course, the transforming effect he had on individual lives, institutions, and countries in Africa. Not to mention his infectious smile, which could light up a room, light up your mind, and light up your heart. Professor Mayosi's research focus, as has already been said in the video, was dedicated to answering the prevailing fundamental questions on African cardiovascular health. It is an area which, up to now, is still regrettably not receiving the attention that it deserves, not least at the moment due to the overwhelming demands of COVID-19. Yet ironically, cardiovascular disease is a key area of vulnerability for severe illness and death from COVID-19. One study published by the European Society of Cardiology last July identified cardiovascular complications in as many as 1 in 4 patients hospitalized with COVID-19. Like us at WHO, Professor Mayosi knew all too well that inequalities in health were a reality long before COVID-19. Cardiac disease, along with non-communicable diseases and other obstacles in the path to universal health care and coverage, have seen minimal research investment, manufacturing, and geographically diversified production of key tools and inputs or innovations in the region. Yet a new WHO report at the end of last year showed that close to 7 million deaths could be prevented by 2030 if low and lower middle income countries made an additional investment of less than $1 per person per year in the prevention and treatment of non-communicable diseases, including heart disease, diabetes, and cancer, among others. These diseases are currently responsible for 7 out of every 10 deaths globally. Then the paucity of local manufacture and production played out starkly throughout the different phases of the pandemic, with African countries struggling to access diagnostics, personal protective equipment, oxygen, and vaccines. We anticipate similar challenges going forward with access to new therapeutics for the treatment of COVID-19. We have much to learn from Professor Mayosi's example in his quest for answers. He built research capacity across the continent undeterred if countries had no existing research management infrastructure or ethics committees. He had the courage to think these were obstacles that could be overcome. His concerns, interests, and the work he was doing were important in the past, but his persistence and commitment to being the change is even more relevant now as we look forward to further transforming public health within and post-COVID-19. Today, 2 years after the onset of the pandemic, WHO has committed to support countries to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing root causes. We must harness the power of science, research innovation, data, and digital technologies to benefit health promotion and disease prevention, for early diagnosis and case management, and to boost the prevention, early detection, and rapid response to epidemics and pandemics. For this pandemic now, we must also urgently prioritize the achievement of our shared target of vaccinating 70% of citizens of all countries against COVID-19 by the middle of this year. Vaccines alone, of course, are not the golden ticket, but they offer the most likely path out of this pandemic. And I'm certain that Bongani would have approved of all the efforts going on. In Africa, sadly, 85% of the population has yet to receive a single dose. We cannot afford to gamble on a virus whose evolution we cannot control nor predict. So the 70% coverage by mid-2022 is driven by the health and economic imperatives of stopping the pandemic as rapidly as possible. It's supported by technical analyses on disease epidemiology and vaccine attributes and a feasibility assessment. Excuse me. The target is also consistent with the downside risk scenario envisioned in the original International Monetary Fund proposal released in May last year. So we need to be weighing up the benefit of investing in certain interventions and the impact on our economies, which in turn then has negative impact on health. If all this seems daunting, Professor Mayosi's unfaltering belief in Africa's people, institutions, and potential, and his pursuit of beneficial international partnerships and collaborations is a reminder to all of us of what's possible. I was very fortunate to spend two days with Bongani at the Faculty of Health Sciences during a visit to Cape Town for a conference in 2016. He invited me to deliver a memorial lecture in honor of another exceptional scientist and doyen of medical education, Professor Marinus van den Ende. I've since discovered a link to the family, to Mayosi's family, through my sister-in-law, Yolisa Lujabe Mweti, who grew up with Bongani in the same village in the rural, now Western Cape, during the apartheid era. And I'm known that the families have remained great friends. So this is a particular pleasure and honor for me. My interactions with Professor Mayosi gave me the opportunity to understand his vision and actions to make UCT's Faculty of Health Sciences a center of excellence relevant for South Africa and Africa. He also shared with me the challenges of instituting change as he worked to transform medical education. This prompts reflection on the role of all those involved in change and the adjustments that are necessary among leaders, especially those who are previously privileged. Making change happen is often difficult, but it is essential to all efforts to achieve equity in education and health and in future development. Prof. Mayosi was just 38 when he became the first Black faculty member to be made professor and head of Department of Medicine. A natural-born teacher, he made the deliberate decision to share his knowledge with others. He lived by his motto, "Lift as you rise," as we've already heard. The debate around transformation and equity is certainly not exclusive to universities, nor to South Africa or to other African countries. We've seen it brought into focus dramatically at the global level. For example, as the Black Lives Matter discourse coincided with the COVID-19 pandemic, starkly highlighting inequity as a common thread. At the same time, globally, we see a digging in of the heels of conservatism in some Western countries. We also see structural and legislated injustices persist in countries like the United States and some in Europe, with certain groups acting to reinforce them. One example is the proposed new voting restrictions in the United States. So why am I talking about this when in reference to public health and health inequities? It is to underline the connection between such inequalities, injustices, with education, with health, with employment, and ultimately with national development. We need to understand the potential of all of this to further drive inequities and impact very negatively on health. Coming closer to home, South Africa, for example, has one of the most expensive healthcare systems in the world, with a private sector that is benefiting from public resources, but with only as few as 17% of the population being able to afford to access the system. This exacerbates unfairness and has negative impact on health outcomes. Overall, there is an urgent need to be more effective in translating resources into good health care for the poor, who in this context are overwhelmingly Black people. This is where Prof. Mayosi focused his research, his training, his partnerships and actions in South Africa and beyond. Translating stated actions on equity into effective strategies encompassing various aspects can be very difficult. The often stated "we're all in it together" stance around COVID-19 at global level, for example, has been a huge challenge and a salutary lesson. What we saw fundamentally was governments in wealthier countries retreating to traditional positions. We've got money. We are the countries where the producing companies are. We've got most of the researchers doing the research, and we should benefit first, and we'll be nice to you a little bit later. Some of the countries that produce essential commodities reserved large quantities for themselves and even banned their exports to communities in need early on in the pandemic. This is unfortunately a repeat of our experience with HIV and the virus popularly known as swine flu. In the fight against COVID-19, multilateral platforms like the ACT Accelerator Partnership and the COVAX facility within that, which specializes in procuring vaccine, which was specially established to ensure equitable access to the key tools, were left struggling. The development of key tools at record speed has been crucial to the pandemic response and saw significant funding and investment. And I think Bongani would have been in there with all of us in encouraging the engagement in Africa in this research and development of new tools. But funding for research on our continent is largely dependent still on external sources. Such dependence on donors is in turn reliant on donor research interests and issues of global interest rather than on local evidence needs. So while the pandemic has prompted much more interest in our continent, there is unfortunately still a paucity of research targeting the priorities of relevance to African countries and people. In fact, a 2020 study by the African Health Research Institute in Durban, along with international partners, found that while Africa comprises 15% of the world's population and bears 25% of the global disease burden, the continent produces only 2% of the world's health research output. It concluded that although African-led research has the potential to lead to health improvement and economic transformation, it has first to overcome significant challenges, including inadequate funding and research infrastructure. While the total global expenditure on research and development has more than tripled in current dollars from $677 billion in the year 2000 to 2.2 trillion in 2019, no African country was listed among the 20 nations that registered the highest R&D expenditure that year. Neither is a percentage of gross domestic product, nor in terms of expenditure per capita. Available data for African countries reveals that South Africa, Nigeria, Egypt, Kenya, and Tunisia are the most prolific in producing new research. To improve financing for research in Africa, the WHO Research for Health Strategy, to which he contributed, says that the following factors are critical. First, having a dedicated budget line for health research, investing at least 2% of the national health budget in health research, along with at least 5% of development assistance funds earmarked for the health sector, and regularly tracking health research spending from all sources. Currently, countries in the African region of WHO spend less than 1% of their GDP on research, according to UNESCO. Conversely, global spending on science and the number of scientists has been rising in the past 5 years, a trend that has really been accelerated by COVID-19. Other internal challenges having a negative impact on African countries include gaps in governance and challenges in translating intentions into actions and results. There is also evidence of countries experiencing difficulties navigating global and international contexts. Bongani was passionate in his advocacy and action to improve this situation. He was prepared to forge a new path to do something meaningful about the inequities negatively impacting the health of Africa's people as well as research in Africa. So too are we in WHO in Africa, very much inspired by his vision, his energy, and his actions. Some examples are related to the COVID-19 pandemic response, but also address pre-existing anomalies. For example, we know that pharmaceutical imports comprise as much as 70 to 90% of the drugs consumed on the African continent. This dependence on imports leaves our citizens vulnerable to shortages of medication. This has triggered an intense, urgent action by African countries within the context of the COVID-19 pandemic, by donors and by international organizations. An example is that in South Africa, WHO, working with other partners, including the European Union and South African institutions and the government, is supporting the establishment of a hub to transfer the technology and know-how in developing mRNA vaccines. This will open the way for these and other similar products to be produced on the continent, accompanied by the training of researchers and those involved in production. We're also supporting two initiatives to bolster genetic sequencing efforts. The first is a regional center of excellence for genomic surveillance and bioinformatics in partnership with the University of the Western Cape to connect to existing networks, including the universities in Durban, in Johannesburg, and the University of Cape Town. By the end of the first quarter of this year, for example, all 14 Southern African countries are expected to be producing their own sequencing data on COVID-19, against only South Africa and Zambia as recently as July last year. So these are examples of investment that has been made with a very clear focus on what is feasible and affordable, and which will drive equity and benefit those that are most vulnerable. Prof. Mayosi would also have been greatly encouraged by the establishment of the African Medicines Agency by the African Union last year. He was strongly into connection between people, between countries, between scientists, between disciplines. The agency marks a turning point in enhancing the connectedness among regulatory authorities in Africa and improving regulatory oversight and facilitating future access to safe and affordable medicines across the continent. This is exactly the kind of concerted efforts and cross-border collaboration that he espoused. The pandemic has accelerated many other examples of the determinants Professor Mayosi believed were essential to transforming healthcare delivery on the continent. These include collaboration between scientists in Africa and further afield, networking between research centers of excellence globally, cross-disciplinary skills development and support, and improved genomic sequencing, for example, to advance surveillance data. Yet, along with difficulties in accessing sufficient supplies of COVID-19 vaccines, African countries are now preparing to face another procurement struggle of critical COVID-19 therapeutics that are fast emerging and that have the capacity to save lives and contribute to ending this pandemic. As long as this virus continues to circulate, further pandemic waves are inevitable. And Africa must not only broaden vaccinations, but also gain increased and equitable access to these beneficial therapies. Africa needs scientists, medical professionals, nurses, care workers, institutions, and infrastructure that will deliver African solutions to African healthcare challenges. WHO in Africa's stance aligns firmly with Professor Mayosi's belief that there is a need to grow our own timber. This philosophy emphasizes excellence while nurturing and mentoring people with potential in order to create a pipeline of future African scientists and researchers. I've been very touched indeed to learn about the depth of Bongani's achievement in this area during this event today. And indeed, COVID-19 has highlighted this need. There's unfortunately been minimal involvement of African countries of the research to discover new products for the pandemic. And if Bongani had been here, he would have been saying something about it and doing something about it. It is critical that we follow his example to optimize the capacity of all people, affording opportunities for all to fulfill their true potential. This is something our countries desperately need. He lived by this principle, training researchers, enabling people to conduct research, using that research, and making purposeful connections. It is extremely heartening, therefore, to see the Bongani Mayosi Foundation partner with Siafunda to establish a learning and data management platform to improve the standard of mathematics teaching and educational outcomes in rural and poor schools. These skills are desperately needed in the country, in South Africa, and across our continent. The Bongani Mayosi Collaborative for Cardiovascular Disease Research Excellence in Africa is another example. This interdisciplinary platform seeks to strengthen and improve coordination between existing research initiatives on the clinical, epidemiological, and basic sciences approaches to cardiac research in Africa. Turning to Professor Mayosi's work specifically, his desire to make an impact on the cardiovascular health of the world's poorest people was what drove him. It's already been stated what research he carried out on the epidemiology and clinical management of scourges such as rheumatic heart disease, tuberculosis, pericarditis, and hypertension in Africa. His discoveries included genes causing dilated cardiomyopathy, arrhythmogenic cardiomyopathy, coronary artery disease, and hypertension. Among his contributions to knowledge in single gene disorders, his discovery, this has already been stated, but it bears repeating, of a new gene for arrhythmogenic cardiomyopathy was widely recognized as one of the most important medical advances made by a scientific team in South Africa since the first heart transplant was carried out. His 2014 IMPI trial of prednisolone in tuberculous pericarditis, published in the New England Journal of Medicine, challenged conventional wisdom, instigated an evidence base in the condition, and in 2017, he led a Cochrane review of this topic. Along with his work with WHO in Africa, Professor Mayosi played a major role in many other international consortia and initiatives to attract attention and research funding to cardiovascular diseases in Africa. He was among the first to recognize the increasingly important role that non-communicable cardiovascular disease is set to play in the 21st century among the bottom billion people. He was acutely conscious of the intersections between the diseases of poverty, a reality which has been dramatically highlighted during the COVID-19 pandemic. I referred earlier to the fact that pre-existing cardiovascular disease has been shown to be a key risk factor for severe illness or death among those with COVID-19, for example. With a high likelihood that Africa has significant undetected prevalence of cardiovascular diseases and diabetes, this could be placing many adults in their 40s and 50s who contract COVID-19 at increased risk. And we have seen in the data emanating from many of our countries that indeed African people, when they do get ill, sometimes get seriously ill at younger ages than we have seen, for example, in Western countries. And then coming back to the issue of equity, which was so central to Professor Mayosi's philosophy and very much informed and drove his work. We've seen that in some Western countries, the highest incidence and deaths from COVID-19 have been among Black people and other ethnic groups, linking disparities in income, in living conditions, in occupations and working conditions, to pre-existing conditions, and to poorer access to good quality healthcare. This centrally informs us of the need, not only for this pandemic, not only for HIV, for cardiovascular diseases, for everything that is to do with health, to linking the determinants of health with research, with data, with work among scientists and policymakers for us to improve the health outcomes in our countries, be it in relation to a COVID-19 pandemic or any other health problem. We are convinced in WHO. Outbreaks of infectious and other diseases in African countries haven't stopped for COVID-19 either. We've had, as WHO, to stretch our resources to tackle outbreaks of cholera, Ebola, and Marburg and meningitis in the past 2 years. Fortunately, these were successfully brought under control thanks to the region's expertise and experience in health emergency responses. And again, some of these diseases have examples of work that was going on during the course of the epidemic, like Ebola, to discover new tools and to use them in response to a pandemic or to a severe epidemic. The response to the many other health challenges remains itself a challenge. Take HIV, for example, in which I've had the privilege to work, as was stated earlier. WHO released an achievement scorecard last month that showed that just 9 countries are on track to reach what we call the 95-95-95 targets, meaning 95% of people with HIV knowing their status, being on treatment, and having low viral load. In its 2020 Global AIDS report, UNAIDS warned that disruptions in HIV treatment caused by COVID-19 could result in an additional 500,000 HIV deaths in Africa. Especially significant for South Africa, which has the highest prevalence of HIV and the biggest HIV epidemic in the world, is the growing body of evidence indicating that people living with HIV who become infected with COVID-19 are at heightened risk of requiring hospitalization and experiencing poor clinical outcomes. So again, and highlighting the work that Professor Mayosi was leading, the connection between different diseases of poverty and the COVID-19 as an example, and equity driving the thinking in how we approach the pandemic in the future. For diseases like his focus area, rheumatic heart disease, incidence remains high and gaps in prevention, diagnosis, and care remain wide. This is despite a substantial increase in epidemiological data to quantify the burden. Regrettably, COVID-19 hasn't done the response to this highly preventable disease any favors. While acute rheumatic fever and rheumatic heart disease are now rare in most high-income countries, they remain a major focus of cardiovascular disease in Africa and several other regions. We have here one of the highest rates of rheumatic heart disease globally, in part because of living conditions associated with poverty, including household overcrowding. Another critical contributor is inadequate high-quality healthcare that is necessary for prevention, early detection and management of acute rheumatic fever, and the management of and prophylaxis for rheumatic heart disease. There are variations in prevalence on the continent, with the Central African sub-region having the highest, followed by Eastern and Southern sub-regions. And I can attest to the fact that we have a lot of work to do to raise awareness of this among policymakers so that it translates among the priorities in countries. In endemic countries, rheumatic heart disease accounts for the most cases of antenatal heart disease with the impact on maternal mortality. It's also a significant indirect contributor to obstetric deaths. In Africa, indirect deaths account for 16% of maternal deaths, and you certainly know that we carry the highest burden of deaths of women having babies. So challenges in diagnosing acute rheumatic fever, the precursor to rheumatic heart disease, remain a major barrier to prevention, especially in low-resource settings. And primary and secondary prevention services play a crucial role in the reduction of the burden. So this is an example of how integrating rheumatic heart disease programs into primary healthcare could be a huge opportunity for improving equity and access to interventions and services and making a difference. We know, for example, that at the very least, the introduction of effective treatment of strep throat with appropriate antibiotics like penicillin can prevent rheumatic fever. So what is needed going forward is to build awareness and education, including among healthcare workers who need to be adequately trained to appropriately diagnose and manage the strep throat. And it is, of course, our responsibility to build awareness among policymakers so that we integrate the needs of these diseases into already existing investment that have been done primarily for communicable diseases in Africa. Improved diagnosis will require development, for example, of new laboratory technology tests to augment or replace clinical decision-making rules. And again, and I'm certain that Bongani would have been advising us this, we need to build on what already has been invested on in the region. And here again, we are learning very important lessons from what is being done in relation to the COVID-19 pandemic. We need better information systems for tracking rheumatic heart disease. And although disease registers have been recommended since the 1950s, very few endemic countries have made significant progress on expanding these beyond single centers. Again, advising, therefore, that we find ways to integrate the needs of this disease into some of the vast data systems that have been developed primarily for communicable diseases in the region. Digital platforms have played a crucial role in the COVID-19 response, illustrating the potential for these and other novel approaches to be leveraged to benefit the response to rheumatic heart disease, as well as other health challenges in Africa. They are certainly being used very much in other communicable diseases. They played a key role in our being able to say we have eradicated wild poliovirus in the African region. All these health challenges, I'd like to emphasize, highlight the need for interconnected, multifaceted responses that fundamentally address poverty and vulnerability, reflecting exactly what Professor Mayosi aspired to achieve. If he were here today, he would urge our researchers, clinicians, epidemiologists, social scientists to work together with communities to not only tackle COVID-19, but to lay the groundwork for our actions going into the future. And most importantly, to expand these connections to address long neglected conditions like rheumatic heart disease. The question of where we are currently with COVID-19 in South Africa and Africa is a critical one in the broader context of maintaining efforts to tackle the continent's other priority diseases. So this pandemic, which may initially have been spread by people who are internationally traveling, generally in the upper echelons of society, as the data told us in the early stages in the African region, has spread even into the most remote corners of Africa as well as the world. So the narrative has changed substantially too, and COVID-19, unlike many of Africa's other challenges, has emerged as no respecter of income, nationality, or social status. Even so, we've seen that its biggest impact is on the lives and livelihoods of the most vulnerable in our societies, partly because of some of the interventions, including lockdowns that had to be put in place early on in the pandemic, affecting primarily Black people, low-income households, women, children, and older people. As we've seen so many times before, most especially with access to antiretrovirals to curb deaths against people living with HIV, more resources still translate into a greater source of a chance for people to survive and to thrive. Our latest data shows that weekly COVID-19 cases in Africa have dropped, so we are in a dip following our fourth wave, and deaths as well are beginning to dip following the peak. We've seen South Africa, which has accounted for the bulk of cases and deaths, recording a downward trend as well. And it was not surprising to some of us that this country, which is our most internationally connected, our most industrialized country, but also the leading country in the world when it comes to inequities in income, has accounted for the bulk of cases and deaths in the African continent. It's a salutary lesson, which I'd like again to link to Professor Mayosi's firm interest in equity and highlight some of the changes that have to be made in the broader spheres in order to have an impact on health and on the pandemic. As we continue the battle into 2022, it's important to reflect on how the great strides made in the response to the COVID-19 pandemic across the spectrum, from the continent's scientists and scholars to organizations like WHO, the African Union, and the Africa CDC, as well as ordinary community members, will have future relevance for healthcare in Africa. Take, for example, improvements in the availability of intensive care unit beds for COVID-19 patients, which rose from 0.8 per 100,000 population to over 2 per 100,000 just in a short space of the response to the pandemic. They may still be insufficient to meet the demands of the pandemic, but they represent significant added capacity for the future. In terms of medication, patients with severe forms of COVID-19 are currently being treated mainly across the continent with corticosteroids and medical oxygen. The steroids are largely available, but the availability of medical oxygen has been a dramatic challenge at times. We have responded, as have governments, by repairing and installing oxygen generating plants in countries across Africa in record time. And again, these will impact healthcare long after COVID-19, including for children with severe respiratory diseases. In the context of our learnings from the pandemic, Professor Mayosi's work reaffirms for us the importance, therefore, of equity, of research, of building capacity, of training our young scientists across the continent, and of working together in creating meaningful connections that provide solutions that ultimately help to address Africa's health needs. While the COVID-19 vaccine supplies, for example, have been on the rise in recent months, the rate of vaccination remains low, with just over 10% of the continent's population fully vaccinated. This is a huge concern because of the economic impacts of pandemics have historically lasted longer than any virus. So we are anticipating that the impact on Africa will be long, and it will have impact in a circular way on health. The IMF has estimated that Africa would be the slowest growing region in 2021, and worse, the pandemic was expected to cause the loss of an additional 500 billion in Africa, leading to further borrowing and additional debt. And we have seen this already confronting policymakers in the region. An analysis in July 2020 by UNCTAD, the United Nations Conference on Trade and Development, estimated that merchandise exports will decline by 17% in Africa as a result of COVID-19. And these statistics are just a stark illustration of the dire consequences of inequity and how they spread far beyond healthcare itself. They also point to the need for stronger links between scientists and politicians and policymakers. We have seen, I have to say, these being strengthened in a unique way during the course of this pandemic. It is critical that these be carried forward into the future as we address other basic health needs and will afford us a better opportunity to make progress. In our hospitals, so meanwhile, taking care of the health and welfare of our health professionals has never been more important. In our hospitals and clinics, laboratories and academic institutions, the life and death of Professor Mayosi served up as a reminder that doctors and nurses who have sworn on oath to protect and serve others and who have dedicated themselves to doing so also fully deserve to have their own health and well-being addressed. Working on the front lines of the pandemic, the care and healthcare workers have been infected, have fallen ill, and have lost their lives. They also face a wide range of psychological stressors. These have had a high chance of affecting their well-being and their mental health. WHO designated 2021 as the International Year of the Health and Care of Workers, launching a call for the increased protection of their health, including their mental health and well-being. We recognize that having been exposed to extreme working conditions thanks to the pandemic, they are particularly vulnerable to deteriorating physical and mental health. Africa's shortage of healthcare workers is acute and very concerning, with only one country in the African region having the required healthcare workers, meaning 10.9 per 1,000 population to deliver essential health services, and 16 of our countries have fewer than one healthcare worker per 1,000 population. This just to emphasize the importance of ensuring that we take care of the health of every single one of our healthcare workers. We're working as WHO with governments to accelerate improvements in this situation. So what should happen in order to move beyond the pandemic and build more equitable and just health systems and societies for the future? First off, we need to strengthen human connection. And Professor Mayosi was remarkably adept at creating networks and entrenching relationships with everyone, from his students to the biggest business magnates in the world, and of course, valuable community assets. We know that health starts at the individual and community levels. We've seen in the work to control HIV, polio, Ebola, and now COVID-19, that grassroots civil society, women's and youth groups, and community leaders play an integral role in influencing behaviors as well as influencing policy making. This is true across countries at all levels of income and development. We know that communities are the vanguards of change. They know the challenges and are well positioned to drive the solutions, and that those in authority need to create the space for their voices to shape their decisions. That is why we are such admirers of the work that Professor Bongani Mayosi was doing, and very much the work of the foundation that has been put in place in his name. His work, along with our learnings from COVID-19, serves as a constant reminder of the importance, again, I'd like to say, of issues of equity, but also of research, building capacity, training scientists across the continent, and connecting to people, connecting to communities. It reemphasizes the need to work together using science and evidence to inform what we are doing, as well as innovation and discovering new ways of working and applying them. Bongani's work was multidisciplinary, which is also very important. He was doing science, he was doing research, he was linking to those with public health and service delivery, and this is exactly what we in WHO have been inspired by his work and by our association with him to emphasize. His approaches are really relevant to what is needed in the pandemic and going beyond. So even though he may not still be with us physically, his lessons are still very much applicable and resonate in our minds every day as we do our work. They are alive in everything that you are doing in South Africa, we see, and in what we are promoting as WHO among our colleagues and our member states. As I come to the conclusion of this lecture, it seems appropriate to leave you with the appeal to follow the example of Professor Mayosi, and again, lift as you rise. In the words of another brilliant scientist, Albert Einstein, let me say that Bongani Mayosi did indeed become a man of success, but much more importantly, I'm sure to him, he became a man of value. We can all learn a lot from his incredible legacy. My colleagues in WHO and I remain hugely inspired by his work, by his advice among us, by his energy. And I would like to say again, every time I think about what he contributed, I remember that bright smile which warmed up my heart every time I had any interaction with Bongani. I thank you very much for having honored me with the opportunity to deliver this lecture.
Thank you very much, Dr. Moeti. Dumelang, Sanbonani, colleagues, Molweni. It is my privilege to close this evening's event and extend a vote of thanks to all who assisted in making this important lecture a success. The loss of Professor Bongani Mayosi, our loved and respected Dean of Health Sciences in 2018, was tragic. And I must say the pain that many of us at the University of Cape Town and the global community felt at the time remains today. His lasting contribution to cardiology, to the academy in general, and as well as his passing, compelled much institutional introspection. Perhaps one should even say the much needed institutional introspection. It just came at too high a cost. We continue to learn from his life and the circumstances of his death. Professor Mayosi was a champion of transformation. He was much enthused by the three pillars of our vision: excellence, transformation, and sustainability. I can recall vividly how his eyes lit when I sat down with him and shared the vision before I shared with the institution. He strongly believed in the potential of Africa and its people. He believed that Africa can. He was an outstanding human being who gave his utmost to help others. His presence at UCT and in the faculty was transformative in so many ways. I have to say he wasn't a transformation project himself, but he was a transformative leader. As a Black African scholar and dean, he had a huge impact. Just being here with us was impactful. Having his caliber in our midst told a story of who we are as a university and what we value and where we want to be. We could point at him. He brought us a lot of respect. He won, of course, lots of grants that benefited many. So we feel his absence deeply. We are weaker without him. Our story of transformation will never be what it could have been with him. Professor Mayosi also impacted positively on his colleagues and his students. I said Professor Mayosi was a champion of transformation, and transformation is important, but you know, transformation is not easy. In fact, a lot of things that Professor Mayosi did, as Dr. Moeti was speaking, and also encouraging us to almost ask, what would Mayosi do? A lot of things that he did were not easy. And transformation was one of those things that he was committed to. And it is not easy. In fact, the transformation journey can be very, very tough, especially for young Black, excellent and highly achieved academics who are breaking ground, as they are often an unexpected presence. And so they trouble the waters just by being here, just by driving the transformation agenda. They trouble the waters. There are plenty of lessons for us as UCT and as the academy in general that we must learn from his life. It is easy to say we are committed to transformation, but each one of us who is committed to transformation has to ask themselves a question every day. What am I doing? And I'm not going to say what are you doing to support transformation. What are you doing to support Black scholars such as Mayosi who are still in our midst today? What am I doing to support Black leaders who are in our midst today? Don't even ask whether they are struggling or not, because let me tell you, they are. They don't have to tell you. This, being a transformative leader, or just even being a Black person who's highly achieved as Mayosi, being what he was, unsettling the waters, would make it uncomfortable. So we don't even have to ask. And we don't have to help because they are not capable, but because we have to help and ask ourselves what we're doing, because the environment is not ready for them. And so they get shots from all sides. It is their faults that are seen rather than, as we should have been celebrating Mayosi's strengths and excellence that the world celebrated him for. So rather than judging, we should ask questions. Professor Mayosi's life and early death must be a consistent leadership lesson for all of us at UCT. If there's one message that we should actually tell ourselves every day when we think about Mayosi's passing, is never again. Never again. And I said this earlier this week when one of the candidates, who's a Black South African academic, asked a question about how do I know whether I'll get support if I get this job? And that was the question at the end of the interview. And it hit me that this is an important question. And having gone through the journey and pain and still experiencing it today of the loss of Mayosi, that question is an important question. And it's good that someone can ask it at the end of the interview session. How will I know? And so we've got to own the lessons that we're learning, that we learned, we continue to learn, and say to ourselves, never again. As South Africa's oldest university, we were blessed with a jewel that we're celebrating today. But we're not doing this on our own. We'd never be able to do it on our own. We draw on many partners for diverse forms of support as we seek to meet our mandate to train and educate new generations of students, scholars, and researchers who will contribute to our society and our commitment to unleash human potential. Many of our partners and our supporters who are here because of the relationship that they had with Professor Mayosi have participated in this event. And in closing, I want to thank them individually. Dr. Matsiriso Mweti, you have provided us inspiring leadership in Africa over the course of the coronavirus pandemic on behalf of the World Health Organization, continuously drawing attention to the inequality that pervades public health globally. And we thank you for your professional dedication and leadership. And Dr. Mweti, let me just say that, you know, it is very easy, or people are often enthusiastic to celebrate one after they've passed on. And I want you to know that, like Mayosi, you, just by being you, it is transformative. It says to me and many other young people who look like you and I, that it can happen. And we are blessed to have your caliber in our midst. And thank you for your message today. Not only sharing what Mayosi's contribution was in the field, but also reminding us what he could have been, what he could have said. And I agree with you completely. As you went on, I thought, yes, definitely should be doing that. And the truth is, we would be feeling even safer. So thank you for honoring us with your presence and for addressing us today. Ntate Sizwe Nxasana, Chair of the Bongani Mayosi Foundation, an outstanding business leader and social entrepreneur, we will continue to call on you for your support and wisdom. I have much respect for Ntate Sizwe Nxasana, for the multiplicity of talents that he brings to anything that he does. If he says yes to a job, then you know it's going to be outstanding. If it's not going to be outstanding, Sizwe simply says no and walks away. We are blessed that you said yes to chair the Bongani Mayosi Foundation. Thank you for giving your time, your expertise and commitment to this endeavor, strengthening. I know that you say we collaborating with you, we're strengthening you, you helping us as well to continue learning the lesson and to continue to shine a light on the legacy of our colleague, Professor Bongani Mayosi. Thank you, Susan. Associate Professor Lionel Green-Thompson, Dean of the Faculty of Health Sciences and co-host of this evening's event. Lionel, thank you for selecting the speaker for today. Of course, your faculty has led UCT's response to the COVID-19 pandemic, and we thank and acknowledge the hard work of your staff and students on the front line for their steadfast. And you know, Lionel, to follow in the steps of a legend like Mayosi, I don't think it's easy. You make it look easy. And we are grateful that you have accepted the job and you continue with it and shining a light on the work of your predecessor in the way that you do. Thank you very much for the work. Professor Mashiko Siteri, Head of the Division of Gastroenterology, thank you for your thoughtful introduction of our guest, Dr. Moeti. Mashiko, every time you appear, it is wonderful. I'm sure the young people who surround you, I mean, I only see Mashiko when it's everything is great. And so when I see your face, I know everything is going to be great. And we're really delighted that you joined us tonight. Finally, I thank everyone who joined us this evening. I wish you a safe and healthy 2022. And I hope that tonight's discussion or lecture has provided leadership and inspiration as we confront the challenges that lie ahead. Thank you very, very much. Good evening.